Um, this is it's an easy and effective way for Asian patients to raise the bridge and to get more definition to their nose. So a lot of the patients that I have coming in for it are Asian, and they want more definition. They want to get this portion up. They want to get the tip a little bit less round and more defined. That's from the profile. And then something like this from the front, it adds symmetry to all of the face. So if you look at her eyes, for example, they look spaced apart here. They're more symmetric here. And the only thing that I did is I added a little bit of definition right in this area. And she was very happy. African American patients have similar concerns to Asians. They want to get the bridge up. They want to get more definition to the bridge as well as to the tip. This is about half of my non-surgical nose job patients these days have already had rhinoplasty with a result that is less than ideal, really. Scarred, kind of the little bumps, little asymmetries to it. Usually it's not because the nose job, things were botched or it's a bad surgery or anything like that. It's just that they scarred in a unpredictable manner. There was a collapse of the cartilage maybe over time, and it's just things that you really, it's not necessarily an error during the procedure. It's just, with time, things happen. Revision nose jobs are really notoriously difficult to do surgically. Scarring makes the risk of poor cosmetic result much more likely, and our most shining example of that, of course, is the king of pop, Michael Jackson. This is a great way to fix things without risking that you're going to go down his road. This patient is interesting. She's 13 years old. She came in and she was perfectly reasonable. She said she had got flack at school for her beaky nose. It was affecting her self-confidence. Her mom didn't want her to go through the misery that she went through because she had the same kind of nose. So when they saw this procedure on TV, they came in. We fixed it in 5 minutes. She's happy because she doesn't have a beaky nose. Her mom's happy because her daughter didn't get permanent surgery at an age where it would be inappropriate to get permanent surgery, really, for her. She is a poor candidate for a nose job because she's 13. Really, she's still changing. She's still growing. She shouldn't be getting permanent cosmetic, not unnecessary, surgical procedures, because you just don't know. Well, you do know it's going to be bad in the future, so you should really not do that. There's no risks, and as she grows, if she doesn't want to do it again, in a year, she doesn't have to. It's no big deal. So the fillers that I use, Restylane, it's non-animal-based hyaluronic acid. There's no allergy testing needed for it. It's present in the bodies of all animals. It's been available in Europe since '96, in the U.S. since December of '03. We've had, at this point, over 2 million treatments the last 6 to 8 months. Very good, easy product to use. Radius is calcium, essentially calcium. There's no allergy testing as well. It's non-animal based. It gel dissolves, and the body, with the Restylane as well, the body grows into the. It acts like a scaffolding. The skin cells grows into a little scaffolding, becomes part of the skin, and so we don't see the kind of problems that we saw with, for example, silicone, which does not become part of the skin. And if you inject, as we all know, if we inject too much silicone, it can travel and it can do awful, nasty things. The other filler that's very interesting is Artifil, and this is something that just came out. It's just FDA approved. It's methyl methacrylate. It's a plastic microspheres, little tiny microscopic spheres in a collagen carrier. You got to do a skin test because there's a collagen carrier to it. Studies in Europe show that the effect lasts for 10 years and counting. So essentially we think of it as a permanent filler. I've been using it. I've converted a few of about 10 of my nose or chin procedures into permanent procedures with this, and it's been great. Soft, smooth. There's really very little pain or irritation with it. It's really a great filler. It's The thing about artifill, though, is that I do have to assume that it's permanent. So I only use it with people who've had a temporary filler and who like the results. And so you have to understand, and you know, I talk to people, and they have to understand that if artifill is used, you really shouldn't be thinking surgery in the future at all, because it does make the surgical procedure, anything that you do surgically afterwards, more difficult. So, nose job, tummy tuck, breast implants, and supersized. New at West Side Pavilion, hopefully not. This transitions me into the next procedure that I do, which is chin enhancement with an injection with fillers. I usually use Radius for this to give the chin more projection. I can take it this way, I can take it this way. And with her, we did both straightened the nose by lifting this a little bit and brought the chin out. Her profile changes dramatically. And you can use, I use, Radius. I can also convert her to artifill. And it's really a very nice, easy procedure. Somebody like this, same thing. I fixed it, took the nose out, made it straight, took the chin out. His profile changes completely. Much more balanced profile, and much less, even though his nose is not any smaller, but it all becomes more balanced, and it becomes less of a kind of nose-centered profile. This is an example of a chin enhancement with these filler procedures. The result is subtle enough as to not be obvious, but dramatic enough so that it's really, it really is there. It's not something you have to squint to see. The interesting thing about her is she was one of the first people that I did chin enhancement on, is that her receding chin has been on her mind all her life. She felt like it made her look really weak and passive. But she was afraid of surgery. She didn't want to go through it, so she wanted to do this kind of thing. The interesting thing is that if you look at the area under her chin, it becomes more refined after the procedure. As the chin comes forward, this becomes smoother. And it's not just because, she's not really changing the position of her face. She's not really stretching her neck out here. And that's, I think, that's kind of interesting. And that happens with, as you enhance the chin.